Today we're tackling a topic that's often overlooked until it's too late. Pancreatic cancer. Known as a silent killer, its symptoms are subtle and easily mistaken for minor issues. By the time it's diagnosed, it's usually advanced and hard to treat. But research shows your body may send warning signs months before diagnosis. Most people, and even doctors, miss these early clues. Recognizing just 3 of these symptoms together could improve early detection by nearly 70%. That's why this video matters. We'll break down 8 critical signs you need to know. My goal? Give you the knowledge to protect yourself and your loved ones. Let's dive into the first sign. Let's start with digestive problems. The pancreas produces enzymes that help digest fats, proteins, and carbs. A tumor can disrupt this, causing persistent nausea, loss of appetite, and unintentional weight loss. If you're losing weight without trying, it's a red flag. One of the most telling signs is a change in your stools. Pale, greasy, floating, and foul-smelling. This happens when the pancreas can't release enough enzymes, leading to undigested fat. You might notice an oily film in the toilet. These changes are important clues. Don't ignore them. Persistent bloating and a constant feeling of fullness are also common. Unlike normal bloating, this doesn't go away after a meal or with antacids. It's caused by undigested food fermenting in your gut. When you experience nausea, appetite loss, weight loss, and stool changes together, it's a strong signal. Don't be embarrassed to discuss bowel changes with your doctor. Be specific about color, consistency, and smell. Details matter for early detection. Your report could prompt the right tests and catch cancer early. Remember, these symptoms together are more significant than anyone alone. Don't dismiss them as stress or aging. Your gut could be warning you about something serious. Take these signs seriously and talk to your doctor. Early action can make all the difference. Let's move to the next sign. Next is fatigue, but not the usual tiredness. This is a deep, relentless exhaustion that doesn't improve with rest. Even simple tasks feel overwhelming. Cancer cells drain your body's energy, and your immune system's response adds to the fatigue. It's easy to blame this on stress or aging, but this fatigue is different. You might also notice trouble concentrating or feeling emotionally drained. Imagine your energy as a battery that never fully recharges. You wake up tired no matter how much you sleep. Physical weakness can follow, struggling with tasks that used to be easy. Ask yourself, is this fatigue new, persistent, and interfering with your life? If so, don't ignore it. Combined with digestive issues, this fatigue is a powerful warning sign. Your body is fighting a hidden battle. Listen to it. Persistent, unexplained exhaustion deserves medical attention. Let's look at another subtle sign. Fever and chills aren't just signs of infection, they can signal cancer. Pancreatic cancer can cause a low-grade, persistent fever or waves of chills without other infection symptoms. This is your body's inflammatory response to the tumor. Night sweats soaking your pajamas and sheets are another red flag. These symptoms are easy to dismiss or misdiagnose as a virus. If antibiotics don't help, it's time to look deeper. Think of it as your body's silent alarm. Persistent fever, chills, and night sweats, especially with weight loss or digestive changes, warrant further investigation. Don't let these symptoms be brushed off. Document their pattern and severity. This information helps your doctor consider serious causes like pancreatic cancer. When fever lingers without a clear cause, push for answers. Early recognition can save lives. Let's move on to a more acute warning. Blood clots can be an early, dangerous sign of pancreatic cancer. Cancer makes blood more likely to clot, leading to deep vein thrombosis, usually in one leg. Look for sudden swelling, pain, warmth, or discoloration in one limb. If a clot travels to your lungs, it can cause sudden shortness of breath or chest pain, a medical emergency. Sometimes an unexplained clot is the first clue to hidden cancer. Doctors often screen for cancer when clots appear without clear risk factors. Any sudden, unexplained swelling or pain in a limb or sudden chest pain needs immediate attention. Blood clots are a serious systemic warning. Don't ignore them. Let's talk about another physical clue. The pancreas sits near the bile duct, gallbladder, and liver. A tumor can block the bile duct, causing bile to back up and the gallbladder to swell. Sometimes a doctor can feel this swelling during an exam, a classic sign called Courvoisier's sign. If the blockage continues, the liver can also enlarge, causing discomfort or fullness under your right ribs. You might not feel the swelling yourself, but persistent fullness or a dull ache in this area is a clue. These changes are often painless but significant. A thorough physical exam can catch these signs early. Don't dismiss new abdominal discomfort. It could be a direct effect of a growing tumor. Now let's look at another digestive symptom. Persistent gas and bloating are more than just a nuisance. With pancreatic cancer, bloating is constant and unrelated to what you eat. It's caused by undigested food fermenting in your gut due to lack of enzymes. You may feel full quickly, and your abdomen may be tight or distended. Over-the-counter remedies rarely help. In advanced cases, fluid can build up in the abdomen called ascites, causing rapid swelling and pressure. The key is persistence if bloating is new, ongoing, and doesn't respond to usual fixes. Take note, especially if it's paired with other symptoms like weight loss or stool changes. Keep a log of your symptoms. Persistent bloating is a warning flare from your digestive system. Don't ignore it. Share these details with your doctor. Next, let's talk about pain. Pancreatic cancer pain is unique. A dull, persistent ache in the upper abdomen, often radiating to the back. It's not sharp at first, making it easy to overlook. The pain often worsens after eating or when lying flat, but may improve when sitting forward. This pattern is a key clue. Many mistake it for muscle strain or heartburn, delaying diagnosis. If you find yourself propping up with pillows or leaning forward for relief, pay attention. The pain grows slowly, becoming constant over weeks or months. It's different from ulcer or gallbladder pain. Combined with other symptoms, this pain is a major red flag. Don't adapt to it, seek answers. Persistent, unexplained abdominal or back pain deserves a thorough check. Early recognition is critical. Let's look at one last sign. Watch for changes in your urine color, dark yellow or brown even when hydrated. This can be an early sign of a blocked bile duct from a pancreatic tumor. When bile can't reach the intestines, bilirubin backs up and is filtered by the kidneys, darkening your urine. This isn't dehydration, it's persistent. Dark urine often appears before yellowing of the skin or eyes. You may also notice pale, clay-colored stools at the same time. These two signs together are strong indicators of bile duct obstruction. Check your urine color regularly. It's a simple daily check. If you notice these changes, see your doctor promptly. Early detection here can speed up diagnosis and improve outcomes. Don't ignore what your body is telling you. Now let's wrap up. These 8 signs are your body's quiet alarms. Alone, they may not mean cancer, but together, they demand attention. Early detection is our best weapon against pancreatic cancer. Share this video. Someone you know might need this information. Listen to your body and act on patterns, not just isolated symptoms. Your awareness could save a life. Thanks for watching. Subscribe for more health tips. Stay informed, stay healthy.